So I'm just double checking whether you got yours. That's all great. Okay, please
Yeah,
continue.
I don't know if I got it. Let me see here. I recorded it on the cloud is where I was going to record it. I don't know where
Yeah,
you were.
did you get that? Because sometimes clients go, yeah, we recorded it, we didn't get it. So if you didn't get it, just let me know.
Yeah.
Uh, if
Okay.
you still
We'll see. Because I think when I start it, I get it. I think you started it, so you might get it. You know what I'm saying? It's the difference in who starts it.
Oh yeah, no, because I don't start recording unless the client wants to, and then I'll send it to you to make sure that you will
Okay.
get it.
That's
But
fine.
so I'm not recording it, but it's showing up recording going forward.
Yeah.
Okay, please continue.
So I was talking to I was visiting one of my other colleagues here, and the whole idea of the I think the empathy, what I took away was the empathy and really connecting with patients. And he's really good at using analogies.
Okay,
What I find, and this guy rocks it, like in terms of orthotics. So he probably does 3 times as many as I do, not just orthotics, just in general.
right.
And like I'm producing more than him, but in the end, like certain things that I want to improve on, he does better. So I'm trying to pick certain things and improve. So anyway, it was good. And so I was being, I guess, more aware and conscious. Especially, I think what I took away was the first visit. That's really setting the stage for all the other visits.
Yes. Yeah.
And and so that was good. There was another patient I saw also yesterday who they're kind of like my most valuable patient. They're usually second opinions from someone else, and his wife referred. So his wife referred him over. I was with him and his daughter. Like they're both going to get orthotics, but he did something. He's going to get something called shockwave. So he did 6 shockwave treatments and the amniotic stem cell injection. So that's really my largest check. It's like $3,000.
Good.
And and so I think it was because his wife referred him over, and also because I took the time, I was listening, a lot of listening of their story, and so then we just have to kind of fulfill that. So if I could do that all day long, that would be a good thing. So
A good day of additional income you're not expecting, right? And that's the thing. One thing what people struggle with, and especially I think predominantly I think in the medical profession as well, is that they've already got a great relationship with the client, but they don't know how to evolve that relationship to generate additional income streams and profitability streams by just offering services they don't go forward. And so that's one thing. But the second thing is that they have an expectation that the client will buy because they are a doctor. And it doesn't so much work. It doesn't work that way. You still got to kind of explain to them, because and I'm going to give you a simple example of that. Have you ever had a mate try to sell you something and you go, because they're a mate, they're going to be able to accept my objection? No, I don't want to buy it. And you kind of get that, like, for example, let's say you had a mate who said, oh, he's got a new job in insurance, for example. He wants to meet you and all that stuff, right? Yeah. And then he's expecting you to buy because you guys are friends together, right? But then you go, oh, it's easy to say no because of the friendship.
hmm.
And then your mate kind of gets that little, oh, okay, yeah, no, it's okay. And he doesn't know how to deal with that. And so I think this is a simple trend, what people go with doctors, that yes, you got the credibility, you got the rapport, you've got all that, but there's still a process to be able to get someone to say, hey, why I want to buy this extra element. And when we get that I call it, that dance correctly, your business is going to thrive with it. But if you don't kind of get it, you get a little bit of uncomfortability, you get a little bit of pushback. And so when I
And
spoke
are you,
to,
Troy, are
yeah,
you
so
saying is that more rapport that you're building, or is it more because what I find my friend does better than me, and he's very good at teaching and explaining, and he's very good, and
yeah,
it's not even that he doesn't sell at all. Like
no,
he says he doesn't sell, but
yeah,
he naturally does. And I think it's the level of the explanation and spending more time.
yeah, and this is something, and yeah, that's exactly what I was saying to you before. You got that dance. It's like you can't have that because you're the doctor. You can't have that expectation that they're going to go ahead and do it. They're not going to do that. So that explanation of why you suggest it, so John, this is kind of why I want to recommend that. And you want them to feel like they've got a choice, but it's in their best interest. And we're gonna cover that today as well. So let's go into what did you get a chance to do? Now, I looked at your homework that you did, and I got to share something funny.
You can't read my handwriting.
I can't read it. I can't read your handwriting. I can't read it. And I've even got it on a big screen. I took it there. When I did, I had no chance going forward. And before I met with you today, I'm still trying. I'm trying to look into it because it's and
Okay,
I'm still not there. Okay.
I can read them. I can read them for you.
Yeah, please. Yeah, please do. Please do. Yeah.
So I'm going to start with the 10 reasons why patients buy.
Yeah.
Um, buy because they've tried all the other treatments. So maybe
Yes.
we're talking specific for orthotics. So they have
Yeah.
tried, they've tried all the other things, and all of a sudden then they're going to do this one. They've had orthotics in the past and it's worked well, so they want
Yeah.
another pair. They believe the doctor, they trust the doctor. They
Mm-hmm.
visually can see their foot flatten or pronate. So they visually can see something that's abnormal about their foot, and then they can understand how that's causing a problem.
Yeah.
They don't want their pain to come back again. So they understand that it's part of the process. I get them out of the pain, and the orthotics help it not to come back by supporting those structures.
Yeah.
They have flex spending, meaning it's almost no cost, or insurance covers it, so it's no cost. I always say, I joke with the doctors that I work with. I say, giving away stuff for free doesn't take any skill at all. It takes much less skill to give away orthotics if ever, so because some places orthotics are covered,
Right.
some
Okay.
insurances cover it, and I say that's not hard to do that. And then friends like their friends like them have orthotics. Their primary care told them, or their doctor told them, that they would benefit from shoe inserts or orthotics.
Mm-hmm.
The explanation makes sense. The explanation that I used intellectually makes
Yeah.
sense to them,
Yeah.
and they see the intelligence of the doctor, meaning they understand the explanation and like, oh yeah, that makes sense. That way that was explained. So those are the reasons they buy.
Yep.
Um,
So before we go on that, okay, a couple things. So each one of them, when we talk about the process, we talked about you become the authoritative in the room. We've talked about that before, right? The authority in the room, and this is something that, and you've identified already that your partner, your colleague, he doesn't actually sell it. He just explains the process. So it's just a simple matter of doing a transformation of this is where we are, but this is what my recommendation, and this is why I recommend do my recommendation. I think one thing when you kind of, and let's look at, it's an upsell, right? It's an upsell, and you want to feel comfortable, and that's kind of when the first one sets the tone for everything going forward. That's why I don't think we need to go into the price of it all. It's like, we're doing this here. I really recommend this, and this is the reason why, and allow the person to feel like, I'm taking it all in. I'm taking it all in, because every one of your clients, I would imagine, they can all afford the services. They just don't know whether the value to the cost is justified. That's really what you have. If we're going to simplify why they won't do it again, and I think you're a likable guy, Donald, and it's probably easier to say no to you than it may be to other people because you got your likability about you. And that's what I talked
don't you
about.
have the same problem? Are you, because you seem like a likable guy too, right?
Oh yeah, yeah, yeah. But I
I'm
did.
just saying, like my personality is more laid back. Yeah, I would agree.
Yeah,
Versus some
yeah,
doctors, they come in and say they have no bedside manner, and they say, okay, you need to do this and this and this, and
yeah.
then the patient says no, and they say, okay, well, I'm not going to treat you. Like,
Yeah,
or
yeah, okay. Yeah, there's another A word for people like that, right? Okay. And if I sense, and I'm strict with it, even in my own first, if I come across an A like that, I won't take one as a client, because I don't want my life associated with people like that.
yeah,
Even if they want to pay whatever, I don't care. I don't want, that's not how, what sales is. Sales is not selling. I said to you, it's like, just show people why they need your services, and show them how you can help them, and go through the process. And that's how the sale is done. Sales doesn't have to be the hard sales. You'll see that I'm very strict with that. And anyone who even has that cultural mindset, if I can't help them, I don't want them as clients. I don't want that people. So when you, and so yeah, you're likable going forward. But what I mean by that likability is that people will be able to say no to that. And so it's like, well, yeah, doc, I might worry about that later, and we might do that later because it's easy to say no. And so
correct.
and so the way that I did last week, and again, I'm doing it on your nature. So yes, I'm doing your nature, And what we need to do is we need to take that caring and showing them that they don't really have a choice because this is the best option. And I'm applying my authority, but you don't realize I'm applying my authority. You don't realize that I'm kind of not applying pressure, but I strongly suggest you do that, right? I'm going to give a classic example. And, again, I give you examples of all these different ways, but, there's a Godfather scene where the guy's in prison and he goes, can you get me out? He said, no. He said, what I strongly would suggest is, you go in there and you do this and you do this and do that. So it's virtually saying you don't have a choice. You're doing it. We suggest you do it, but no matter what, you're going to get hit. You know what I mean? So strongly do this and protect your family. So you're sending a message saying, you got a choice, but you don't have a choice. We both know it. I'm just wording it in a way that you get the message. And that's does that make sense? That's how I want you to do it. I want you to be able to live like a Godfather thought process where, hey, you don't have to do it, but yes, you got to do it. I'm just trying to make it as easy as possible for you to understand why you got to do it. And so when I was meeting you before I met you today, when I was looking at the direction and strategy which I want, that's why I'm using the Godfather analogy, because it's a perfect metaphor for it. It's like, how can you get people to say, this is what you need to do and why you need to do it? And I like what you said there about the pain element, because that's what you're doing. We're starting the pain. It's like, but we want pain prevention. So we want to look at past, present, future. John, and you want them to be educated. You've got pain in the past. How's it affecting your life and changing your life? You can't run, you can't do this, you can't do all these things now. No, that's not the past. That's how you're feeling. That's affected your life. So now you've got the past and current mixed together. Yesterday you had pain. Today you've got pain. And I'm going to come up with a solution that's going to fix it. But guess what? I can't fix you having pain tomorrow. That's why we need to do this for tomorrow. And the best way is I want you to really make them feel that I don't want to go through that pain again. Does that make sense?
Mm-hmm.
Yeah. Okay. And how do we do that? And doctors do it all the time. Whatever you do, when you feel better, make sure you take the prescription, take the antibiotics and keep doing it. And it's got to a point now with me that I will follow my doctor's advice to the letter, even to the last, and I feel great. I'll still take that last tablet. I'll still do that, because the ramification is going to be worse and I'm going to follow his advice. That's really what you want your client to do. Follow that direction. And we're going to set it all up with the first one, which we're going to do a role play. So I like what you did with that. What question, when you did that exercise, Donald, did you feel, did something evolve with you and how you thought more deeper about your services and why someone would want it?
I was probably just doing my homework. I wasn't thinking, these are things I get all the time. Actually the reasons why I don't buy are the things I get all the time. And it took me a little bit more to think about the reasons why they buy, because when they buy, I don't have to think about it.
Exactly. Okay, right. So yeah. And that is why we do this exercise. It's so powerful. You go, hey, I've got a really great product here. Why not people? I want you to do it. So this is like a mindset transformation. That's why that exercise is so powerful. That's why we don't rush it. We don't sit it and we go, why is someone buying it? And because people think that they're selling a product, but they're really not. And what I see with the product you're offering is you're offering a better tomorrow. If you were to summarize it up, John, if you want to come up with a nice catchphrase, John, everything we're going to do now is just giving you a better tomorrow. Because you know what it's like not running and it affects your life there. And this is the thing. Today we can do something about it. 10 years time, I don't know what we can do about it. I don't know how your foot's going to be evolved. I don't know. So when I was thinking about things you say to a client, I would imagine that if I've got a sore, I've got a pain, that's going to get worse over time, right? It could lead into something a little more serious as well. So now it's not something bad, but we want to be mindful of it. So prevention is better than cure. But at the moment now, we've got a problem that we can deal with. I don't know what that's going to be like in 12 months' time. So I wrote down when Australia kind of I want you like a little bit of a fear element of a fear of loss, that we got a solution now, but I can't guarantee if we don't follow it, because that's going to be a motivating element. Remember, logic unlocks the mind, right? Emotion unlocks the wallet. Yeah, that emotional feeling of what they're doing. And I think once you get that up, your conversion rate's going to be substantial. And that's probably what your friend is doing as well. He's doing the explanation. So we're going to explain it of what could happen if we don't do it, why you're recommending it. And I think then that's the direction for your personality. And it's not going to be too hard for you to transition into that explanation by doing that strategy. That makes sense? Okay. So any questions with that before you tell me why someone won't buy?
I guess the question is this fear of not having it come back is this something that I'm repeating each and every time? This is something, let's say the first visit, I'm usually not talking about orthotics, but I'm kind of framing it with this. We have treatments that can help you so that this won't come back in the future, right? So this pain doesn't last or this pain doesn't come back, right? I guess, am I only doing it before I'm offering the expensive treatments, or I'm just doing it in general for pretty much for every patient now, it sounds like?
And we're gonna do that when we're gonna, because you're gonna show us the slide and stuff like that there. And so we're gonna do it the subtle way on how you're gonna show this in the first one. So you're doing the first one, and we're gonna do it subtly going forward and saying, John, let me ask a question. Are you worried about this coming back? Because deeply this is what's happened with our other clients. And so this is kind of why I really strongly suggest we do that. See, when you do that, again, unless you got this is why your closing rate will be very high. It's very difficult for the client to go back on you if they look at you as the authority. But I think one thing happening, and this is all positive, right? They look at you as too much of a friend type of process, and it's easier to say no to you because just based on what you said to me before, when you get people into the second one, you do it, you've got conversion rate high going forward, which again, I would expect it. So we're just going to kind of match it up a little bit, come up with some really good, better words based on your personality, and just streamline the session one, that it's going to be an assumptive close. It's like an assumptive approach. It's like, McDonald's, do you want fries with that? We're never going to say no unless you really hate fries, right? And so why are they going to say no unless they really don't agree with what you're doing? Well, why are they there in the first place? That's kind of how we're going to go with it, right?
Okay, unless they have some of these reasons they can't buy. So let's go over those. So I think the reasons they don't, accept treatments. I think this isn't specific to orthotics. This is in general.
Yeah.
I think number one is if they don't trust me, meaning if I go too fast, if you offer it right away, there's no relationship. Whereas the opposite, if someone's referred over from a friend or a family, like that trust is already there, so it can go a lot faster.
Yeah, I want to stop on that one. I want us to go that one in depth. That is so true. And that's kind of what we talked about with the first one as well. See, a referral, you've already got the credibility. Well, he's been able to help me here, right? Yeah. And that's how Conman builds it. That's how Madoff and all that. They built the big Scott, the $1 billion scam and stuff like that, right? Bernie Madoff and all that. Everything was on referral. One thing that Richard Dreyfuss said, he said, it's easy to get people money, just say no to them. Oh, can I give you $100,000? No, you need, no. Keep your money, keep it. But we've got a special one now, but it's going to be like $500,000 you got to put in, but no, you keep your money. And if you tell people no, they want it more, right? That's how conmen take that whole concept of building that element on it, right? And so so when you got that referral, it's like, oh God, you're making that money, great, we'll do it. That's how pyramid schemes are done. Whoa, you're making money, let's do it. So if you focus on that with the referral, with the new client, it's so different because they have got a right to kind of say no. And this gets back to, if you're really, really likable and they like you, that doesn't mean they're going to go ahead and do business with you because they like you. See, I don't want to complicate this, but I'm going to do this, right? If I said to someone, guys, look, you can take that advice or don't take advice. It's okay. I can only advise it, but that's why I strongly recommend we hired me in the first place. Up to you what you want to do. they're going to be more likely to follow that advice because they're paying for that advice, right? But if I go, you know, something, you know, what I really suggest, and this is really why, and I've had so many amazing clients get this done, and please do this and please do that, I'm going to lose credibility on that. You understand that, right? That's where the authoritative element comes into it. So
you almost like take it away. Sounds, you know, we can, you know.
sure, absolutely, yeah. Look, yeah. One thing I say to every person: don't be afraid to lose the sale and walk away. In fact, if you look at the sales process, and number 4 is like qualify the sale. If not, just don't do the presentation. So yeah, if I get someone in and they got the wrong attitude, I say, no, let's cancel and refund your money because, you know, you're wasting my time. Pick up the phone. What are we doing here? Yeah. And so it's like, because if they get off, my life doesn't change, right? If they stay on, their life may change. You understand that, right? That's what it is, yeah? And you're that professional too, Donald. I want you to be the professionals come to, right? Yeah. So when you give advice, I don't want them to kind of, yeah, you be nice, you be likable, stuff like that there, yeah? But at the end of the day, you can help them and you know what's best for them.
Yeah.
So, and this is a very fine line. Again, that's why I said right at the beginning, right? So before I met you today, I did a lot of preparation based on your personality and what profile I wrote about you. And so I think people are like, you're likable, they like you, but then the trust element can be there. Like they could like you too much and, oh yeah, I don't need to follow your advice type of thing, right? Where someone else, they wouldn't say no to them because they're going to follow their advice. You know what I mean? Right? That makes sense, yeah? And I'm going to give you one very, very quick basis. Let's say you hired me as a lawyer and I told you, under no circumstance, you get understand. If you get understand, you're going to lose the case and I'm not going to take you on as a lawyer, right? And then someone, or there's the other lawyer who goes, oh yeah, well, you could go on and say this advantage of this and going forward. You have a choice. You go, someone who knows what he's talking about, got a good reputation, and saying, no, you don't go on, otherwise I'm not going to take case, or the opportunity. Your chances are you're going to go with the person who says, okay, this person's a bit more authoritative element. I'm going to listen to them. Okay, good. I won't go understand. I'll take your advice because I'm following you. So this is about the authority. Authority is a very, very fine line in sales, and especially I think as in your profession and the medical profession.
And that's what, and up till now, I feel like maybe you said I closed too soon, but the kind of the thought up till now is like, okay, instead of saying, oh, I kind of recommend being wishy-washy, you know, I was trained, okay, you know, this is essential, this is vital for you, this is, you know, using more decisive words, exactly like you said, meaning I know what it takes, and I know it was kind of confusing for me last time because the way I tend to present it is like, okay, I know what they need. This is what you need. And now it's almost as if I'm going backwards and saying, oh, but it's up to you.
Okay. Oh, sorry, Don. No. Okay. I'm talking. Okay, so we'll stop. I'm not talking delivery. I'm talking conceptually. The conception, no, not delivery. Delivery is very, very different thing. Okay, very different. And we're going to work on that. No, I'm talking conceptually. We want to get them in that thought process, right? Yeah. So with yours, we want to make them feel like they've got that opportunity, but you're strongly, again, the classic example where I gave you the example of the mafia element, right? Yeah, you got a choice doing, but this is what I strongly recommend. And we're going to set that up. When we do the first one, we're going to set that up just by, and with you, because, you know, you're likable, you don't have that overly expressive personality, right? Yep. So when you talk, it already comes across direct anyway. So this is it, right? So you don't need to be more direct. So I said, no, we don't. And doing the delivery, we're going to make it friendlier in the delivery, but the message and concept is going to be a bit more direct. Again, I'm not trying to confuse you here, right? And I know exactly, and that's what you're learning now, and it's going to make it easier. But that's what we're doing. The concept is what I just said, but your delivery has to be more friendlier and advise you because you're already direct when you talk. And I think that doesn't scare people, but that's kind of what you're struggling with. And we're going to get over that. We're going to get over it in a very short period of time in the delivery, in setting it up. So that's the perfect one with the referral. And that is why referrals will be good because you don't have to impress anybody going forward. With the new people, it's different. That makes sense, everybody?
Yep.
Yeah. Again, I'm not trying to be complex with you, and I know you understand what I'm saying. You're an intelligent guy, but that is the complexities of why you're not getting your sales because of that confusion element in the message without you realizing it. The client's getting. That makes sense there, right? Yeah.
Good.
Is that helping
So
you?
from what I hear, it seems like a lot of times the patients might think I'm more friendly than I'm authoritative. Is that
Yeah.
what you're saying?
Yes. Yeah. 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 And because when you talk, it's very direct anyway. But you got that not that, but you got that honest nature anyway about you. So it's easy to kind of say no to it. And we're going to be able to remove that. We're going to be
Okay.
able to do it in a very short period of time. Number two, no, why people
Too
not buying.
too pushy, meaning
Okay.
asking.
Yeah, yeah. It gets back to what we just said before. You're not pushy as such. It's just the delivery is very direct. Very
Uh,
direct. That's it.
ask like you said, ask too fast or too soon before there's that credibility, that no liking and trusting is developed.
Absolutely. Yeah. You're selling it when you don't need to sell it. You don't need to sell it. Right. Yeah. I'm gonna very, very quickly. I got a guy who sells like $100,000 whiskey investments, and one thing he did, he used to say, when following up down, and he said, and how soon we're wanting to look at possibly putting whiskey into your portfolio, and he was saying that within 15, 20 seconds of being on course. He can't say that. He goes, why? I said, because already you're putting pressure on them. They're going to run away already. They don't know nothing about why you're investing it. So that, and he just removed that. He just removed that element. And then the conversation went so much smoother for him just by removing that. Don't say, yeah, then I was getting people saying, oh no, and pushback. I said, remove that, come up with a different way. Don't put those words in. And he said, oh, yeah, I can get further down the track with the presentation. So that's what I mean. Just by removing that simple little word or phrase that you may not even know you're saying now, it's going to be able to project it across. And when you did the role play with me, that's the first thing I felt is you were trying to sell me something. And we're going to remove that. Make sense?
Yep. Yep.
Good.
Other thing, too expensive, or they say they don't actually have the finances for it.
Okay, we'll stop there. No, not at all. I don't believe that's okay. So that's an objection people are giving you, and that's fine. So we'll look into that's the objection we're going to give you. We're going to deal with all that, but that's not the reason why people are not buying. The people, because everyone goes to you can afford your service, I would imagine, but it gets back to the value to the cost. They don't see
They don't
the
see the
value.
value. They don't see the value equation. Yep.
Yeah, yeah,
Some like that's another thing. They don't see the value of the treatment.
yes,
They think they'll get better with other treatments, meaning they just want to give it time and try other
yep,
things. And they think, well, I'll do the expense. A lot of patients think, well, I'll do the insurance things first. I'll do what's free or covered by insurance first, and then I'll do these other things. That's what a lot of people think. The
yeah. So,
concern,
so I did the same exercise as you, and that's what that's one of the things that I also brought up. I did, but one more. It's like, but again, that's not the reason. It's just value to service, value to cost.
the concern about fitting it in their shoes, because there are certain shoes you can't wear because of wearing the devices, the orthotics. So some females, especially, they don't want to switch the types of shoes they wear.
Okay.
Some don't want orthotics because they've failed in the past when they've worked with someone else. They've had a bad device, or the device
Okay.
didn't feel comfortable, so they're concerned about that.
Okay.
Um, they think that there are other cheaper ones they can buy over the counter for $30 or $60, and
Yep.
they're kind of in their mind they think they're analogous.
Okay. So Don will just address that. Okay. So one again goes back to a no trust element, right? Yeah. And again goes back to the value to cost. Yep.
And then they have to talk to their spouse, and then or whoever, and then some they weren't expecting it.
Okay.
They
Yeah.
thought, they thought, that wasn't going to be part of it. They weren't sure that was going to be part of the whole getting better thing.
Sure. Okay. Right. Talking to the spouse is just an objection again, just an objection. But yes, and you've identified that as well, which I identified, right? It's like that slap in the face type of thing of what they're not expecting. There's like free, and now hang on, you want them to pay $1,500 or $2,000, depending on the treatment side. So I think this, and again, that's why we want to set it up on the first one naturally going forward. So each one of them, I want you to I want you to think about this. Why people don't buy something with there's people think there's an infinite number of reasons, objections out there in selling in what you get. So if I said to you, okay, then why would someone not buy going forward? People think there's an infinite number of reasons. There's only 6 reasons why someone will not buy any product in the world, right? I do this and so it's like, oh, yeah, if you can come up with another one that doesn't fit in the category, you get $10,000. You're doing seminars, and I never lost money since, ever. So there's only 6 reasons. It's no time. The person's not going to give them time to kind of listen and communicate with them. It's no help. People are not helping us. Like, why should I buy this phone over the other one? People, I don't know. You go in a shop there, no help, right? And then you got no time, no help, and then you got no trust, which we talked about going forward. We have no money and we have no need. Okay, but one of the most important things, and then it's like, okay, then no hurry. There's no hurry to do it. There's only 6 reasons why some, and anything you can think, any objection will fit into one of these categories. With you, you're already given the help. We know that you're already given the time, you're given the evidence. With you, the trust, and again, I think trust is just a simple matter of you've already got that being done. What we're going to want to involve on that. No urgency would definitely be one, but we're going to be able to deal with it. No money. I don't believe that financial investment. We're just going to deal with the cash to value, the money to value of why I'm going to do that. And that's when they're going to look at other alternatives going forward, because they're thinking if there's a cheaper option out there, that's great. But why am I thinking that? We don't think that when we go to a doctor. When we go to a doctor, Donald, we don't go, oh, no, do I really need an MRI? Do I need that? We never say that, ever. So why is your patients thinking that with you? We never, do I need an MRI? It's a bit expensive going forward. In fact, if you said, do I need that because it's a bit expensive, the doctor would look at you like you're strange. How much? Oh, I don't know. But yeah, we need this going forward. He would just say that, and you go, okay, I'll do it. So,
Well, and that's
yeah.
true. When I've never had someone say no to an MRI when I order MRIs. So
Because yeah, again, so, and this is the thing. Well, why do we need an MRI? Because you want to know more about it. So they're already following your advice, and that's what I mean. They're following your advice. So between then to the transition element, why are people saying no? Realistically, they shouldn't be saying no. I need MRI going forward. So, I don't think I want an X-ray going forward. It's only if you kind of get that, you go home and you think, do I really need it? Is there a better option? But that's because the credibility I have for my doctor, I'm thinking that feeling. If I don't have that, if that credibility and that authority is high in my mind and the standard is high, I'm not going to go against my doctor's advice. That makes sense there, right? Yeah. When you did the reasons of people not buying, what did you learn when you did that exercise?
I feel like I needed some tools to get past some of these things.
Okay.
And
Yep.
I don't think it's that they're that far away, but I feel like I need some tools to help address those.
Yeah. Okay.
And
So
and the tools might not be addressing them head on. It might be more positioning to prevent them from coming up.
yeah, it's so the key to us is to getting that is positioning the first presentation, the first session, to be able to open up the door. And that's what we're going to do now, right? So I'm going to do a role play with you. Elevator pitch. Can you do your elevator pitch for me?
Hi, I'm Don Pelto. I treat everything regarding your foot and ankle. There's nothing in the foot and ankle that I can't help you with.
Okay. So that's like an advertisement.
Okay.
Right. Okay. And the reason why I say that is when a patient comes in and sits
So
down.
are you saying these what I say initially when I go into the treatment room with the patients, or when I'm meeting people on the street corner?
Okay, so the if you're going to meet someone on the street and they kind of say, your
What do you do? What do
ALA
you
meeting
do?
or something like that, yeah, you want to do it. But the reason why I take the elevator pitch even further is that is the foundational point that you're going to be talking to. That's what your business is built on, that elevator pitch, right? So when someone comes in the first time going forward and they say, "Hi, how are you? Good, thank you." Well, and I want you to just kind of feel really comfortable about what we're able to do.
So
Right.
so usually so
Yeah.
usually when I so th this is a so usually when I come in, they know who I am. So hey, I'm Dr. Pelto. I'm one of the docs here in the office. What's going on? That's how I start.
Yeah. Okay. So
I
yeah.
don't give them like my resume and everything that I've done.
No.
And
Oh no. You don't want to do that, right? And again, we got that friendly approach going forward. Yeah. And so okay, I'm going to tell you what my problem will be, and then straight away you're going into that problem element, right? So there's not that rapport element there. So if you come in there and say, hi, Dr. I'm Dr. Pelto going forward. If you don't mind me asking, what's happening with your foot at the
So
moment?
I tend to try to get to know them. I ask about them, what they're, what they're
Good.
doing, where they're
Okay.
from,
Yeah.
some small talk initially, and then we
Yeah.
get into the problem. So I
Yeah,
don't.
and yeah, that's fine, right? So now what I meant by the elevated pitch is like, the elevated pitch will be put in when you start introducing the other areas of your business, right? Robotics. So, but the elevated pitch is more so in your mind for you to be able to use those things in the delivery, right? So it's not so much a patient will come in and you do an elevator pitch to them. No, you want to do it the approach you're taking now, the casual, easygoing approach. That is correct, right? But your elevator pitch is on as, well, why do we do what is shockwave going forward?
Oh, so
That's
how do
what
I?
I mean.
What are my scripts for explaining shockwave and orthotics and things like that?
Exactly. Yes, exactly.
I
So if you were
misunderstood.
there and that's why I said your first elevator pitch was like an advertising more so, right? So you do that and then say, and how we do that, for example, we work with shockwave, blah, 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 and we would do this, and we look at conventional methods and unconventional methods, be able to help people with all foot. Do you see how now we expand the area in a very short period of time? Right? Yeah, by doing it. Now, would you say that to patients? Yeah, sometimes you probably would. Like if I come in there and I said to you, look, I had this problem, I've been suffering going forward. You say, well, John, just let you know a little bit about what we do and we specialize in here going forward. We've been in this going forward. What we've found is conventional methods or unconventional methods sometimes we can improve on. For example, we got this, and I'm going to go, okay. Like if you had a patient like me, I would want to know that. I want to know that you're going to be different than everybody else. I don't, if you kind of go to oh, okay, how it's going, well, we could do this and doing it. But then, yes, you've done the initial consultation, but then I want to know, okay, how are you different? What's going to make me come in again tomorrow? How are you going to stand out from the crowd? And where you're going to get that from, Donald, is the elevator pitch that we're working on now. Do you see how it joins up?
And I guess I'm asking, is this something so if they come in and I don't know what they have, it sounds like it would change based on what their condition is, what I'm going to emphasize.
Sure, yeah. And also the type of person sometimes you're speaking to as well. So if I went up there and I'm showing really a great concern, say, oh yeah, I can't walk, I can't run, and I look influential, I'm in shirt and tie or something like that. I want to know more than just, the odd, the teenager comes in 20 in a t-shirt type of thing. You understand that, right? I kind of want, well, John, just let you know, what do you do? I'm a lawyer. Okay, right. So you're sitting down all the time. Yeah. He wants to know. He wants to know the robotics. He wants to know about shockwave. He wants to have that. And when he says, well, what is that? You have to that's where your elevator pitch. You can't kind of go, oh, it does this and that, because he's going to be analyzing you on, do you know your stuff? And what's this shockwave being done? And the difference between that delivery and why, I really want you to work on the elevator pitch, that delivery then will be determined of whether or not you're going to probably get his business. If he likes it, he's already expecting. So, we may recommend this as well, but let's just see where we are. That's kind of how we're going to position it, right? And so, okay, good. So, John, we were talking about the shockwave. This is why I recommend we have 6 sessions on that, and this is the reason why. Done. It's like, okay, good. So I'm already aware of that going forward, yeah. And then this is also, I want us to think about. We want to do this other thing. We want to look at this session, and this is the reason why, because we can fix the problem now, but I can't guarantee it's not going to come back, right? And the last thing you want, John, right, is to feel how you're doing now, today, correct?
Oh,
Yeah, So do you see again, and this is something, Donald, that you're going to constantly, from now
so this is
going all the way
I
through.
misunderstood. When I've read about elevator pitches, you're talking about yourself when you meet a stranger. So you want me to explain orthotics? Is that what you wanted me to do? I didn't understand what you wanted me to do.
Yeah, okay. So look, I'm putting all on the elevator pitch, because the elevator pitch is kind of, what do you do, and also then take it further. What do you do that makes you stand out from the crowd, and what can you offer going forward? Yeah, and so each one of these things at different times you're going to be calling up, whether you're going to be face to face. So if you go up in front of a group, you're like, okay, how do I introduce myself? I don't want you to say what you just said. I want you to say what you just said and say, and we do that with shockwave going forward. This is what we do at the foot, etc. And it's all going to become natural process for you. That's why this is a foundational point that your business will grow on with that foundation, and we're going to expand that different areas. So when I say, okay, now expand the shockwave to me, you will already know. You don't have to pull it out from somewhere. It's going to be automatic to you. That makes sense. And you're going to find, excuse me, and the more comfortable you feel with this, Donald, the more you're going to be introducing it into the consultation section when people come in. If I'm a business owner, you've got a business guy coming in, he goes, yeah, going forward. So, you can then in that short time, I look at the foot going forward, and now some treatments that we might suggest for you, John, will be this, but I don't know yet, but that stands us out. That could be enough that you're going to already close the deal when you're in your second consultation. Do you see what I'm saying there with that, right? Yep. So this is something where, and I know what you're saying, and I'm not trying to confuse you, saying, well, Troy, do I put it here and put it there? You're going to find the more comfortable and relaxed you can deliver it. When you got a guy walk in shirt and tie, it's going to probably become automatically part that you're going to say those things because you know he can afford it, right? But would you say that to just the again, teenager, 22-year-old in t-shirt? Probably not. You understand what I'm saying? You wouldn't do that. So you pick him up, and that's going to help you. That makes sense?
Mm-hmm.
Okay. So what I want us to do now, I want you to I'm going to get you. You're going to do a lot of talking now. I'm going to get you to demonstrate and role play to me. Did you look at the slide and stuff you said? Yep, you got that, which again was good. Did you get a chance to look at that again in your presentation?
The slide?
You got a presentation, correct?
I do it every single day, multiple times.
Yeah, okay, right. So I want you to deliver that again. Did you get a chance to look at it and make any, based on what you're learning now, can you see how some parts of the slide works and some parts may not work with the delivery?
So I don't think we talked about that. I think we talked about being more empathetic. So I think that, and I was giving more options versus I think you mentioned the slides seemed to be okay, but you recommended just changing the way it was delivered, right?
Yeah, that's what I mean. Yeah, I'm not talking about you making changes to the slide. It's more so like, are we getting that message across? So yeah, let's bring that up, please, and we'll go with that.
Just bring it up here. Okay, Troy. So you've been dealing with your heel pain. So Troy, welcome to the office. My name is Don Pelto. I'm one of the podiatrists here in the office, and we see this heel pain quite a bit, probably multiple times a day. Tell me what's going on.
Yeah, I was running. I jog all the time, but 2 weeks ago I started getting sore. Gradually got worse, and I thought, hey, last week I thought, I'll rest it again. I keep pushing on it. It's pretty painful. So I thought it was not a big deal, but I'll be honest, it's getting a bit concerning. I'm also a lawyer, so I sit down at my chair and just recently, I go into a client's meeting, I'll get up there and I kind of feel tingling and pain, and it's like, oh, what is that type of thing, So yeah.
And it's been going on for a couple of weeks, that pain, right down here, right on the bottom of the heel.
Yeah, it radiates right all the way down to the leg, actually. Yeah.
And have you tried anything to help treat it, Troy?
Sure, painkiller, get the wife to massage it going forward. My next, before I come to you, because I've got
A massage? What do you
sore
do?
back as well, and I'm going to go to chiropractor and tell him I'm supposed to be meeting him tomorrow. But yeah, so I thought, hang on. But then today I got up and it was like 10 o'clock. I got up and it's like, gee, the pain just got radiated. So instead of going to hospital, I thought I'd come to you and see.
Yeah. Troy, a lot of people, they go to these urgent cares or hospitals and they don't do too much there, so it's probably better for your time to come into see us here.
Okay, we'll stop there. That was brilliant what you just said. And so what we want to do, that was like, wow, right? So don't rush that part. I want you to stretch it out. This is something that, the direction we're going forward, Donald, is I don't want you to make your messages short and sweet like a lawyer. I want it to be stretched out. That's where the empathy is going to come. So for example, you'd say, so, John, this is a problem when people have that. They don't realize the foot is a specialist area. right? Yeah, for example, if you kind of got a sore throat, you got ENT, etc. People think, oh, foot, just go to any doctor. But what they don't realize is it's a complex area, the foot, right? And at the end of the day, something, think about your foot. Every single minute of the day, you're out of bed, your foot's being stamped on, pushed, thrusted, pain. Every single moment that you're out of bed and you're standing, think about that. And then you got shoes going forward. It's a complex area. And that's what we specialize in. So, yeah. And other doctors don't. So we'll stop there. Do you see again, this gets back to a little bit, and we can add on to that elevator pitch of explaining. And I'm going to remove the word elevator pitch now, not complicated. Let's see. So this is where I want you to explain this part of it, because this is powerful. Now imagine if you do this really well, I'm never going to go to another doctor. I'm going to come to you because I understand, oh, I just thought of my foot. No, it's this particular area. That makes sense? Now, I want you to think about something with that, Donald, right? If we got any part of our body, we'll go to a specialist in that area. Yes? Yep. I don't want people coming into you with the foot and not thinking that, hey, this, podiatrist is just, this is serious. And so I want you to set the stage. You're setting the stage of why do people go here, when you got a problem? Because of that, you're showing your authoritative element with that, correct? If I go to a lawyer, I know what the lawyer's going to do. If I come here, I've got a pain, so here I am, I can't stand up, I can't stand, which I would imagine people telling you that all the time, right? Yeah. And so see how by me stretching it out and making a bigger, for me to get the client.
It sounds to me, Troy, it seems like you make a big deal out of the obvious to me, but it's not obvious to you. You know what I'm saying?
Exactly.
And I don't know how to explain that, because I would never think to say, your foot is very, very complex. It has, this many bones, this many tendons. You're walking on it all the time. It has a lot of different problems. So you're in the right place to take care of your foot problem.
Yeah,
I would never think to say that, but I'm fine. That's what I'm here for. Let me.
Yeah, if I wasn't saying, you think, hang on, what? Okay, so he's not teaching me that. So I'm glad you did that. Yeah, and again, and I liked how you react with that, Donald, because this gets, if you know, so I'm coaching to your personality because I know you can do that. So anything I get you to do, and even when I role play with you, it's on Donald's personality, not John's personality or Michael or Paul or anyone else in your office. Do you understand that, right? And so this is something that it's an easy transition. I know you're going to be able to do, and you may not have thought about it. And you go, oh, I could stretch that out a little bit. And then that's why you're going to get a quick result very quickly. So yeah, I want you to explain that. And
I remember one guy who's good at sales, and he always said the best salespeople in his office were the ones that just talked the ear off of the patient or listened, and the same thing with my buddy. Like he just goes and overboard, and I'm thinking, gosh, this is like so obvious. Like why is he going into using these lengthy analogies to explain something that it's just so and so what I'm getting from you is I think you have to just pull. Maybe it's just a personality thing. I just need to be more
okay. So yeah,
verbose.
okay. So to contradict you a little bit, yeah, no, you don't, because sometimes we got death by PowerPoint, you get death by talking too. So you don't want to go into it where because you got a short period of time again to get that. So in a very short period, like in 30 seconds, you could say kind of what I said going forward, complex there. And that's why people come. And straight away so we're not just saying words, we're saying that we're getting into the mindset of getting them to understand what you want them to feel. You understand that, right? Going forward. Because then if I said that the way I said it to you, when you left my clinic, would you go to a doctor? No, you'd come back to a specialist like me, right? And because I've told you about, and we specialize in it, you have two choices, Donald. You can either go to a doctor, which you're not going to go to a doctor because you don't come to me, or you go to someone else. Why would you come to someone else? So straight away, you've already cemented me as your client already. So think about that. You've already cemented me by just saying that then. It's like, yeah, and the people are going to, like, John, what do you do for a living? Oh, I'm a lawyer. Okay, right. So no one would go to a dentist if they want law advice. I don't know, I'm exaggerating, but that's what people don't realize. This, and they'll go, yeah. And when you do that, and when we do the delivery too, I want you to do a delivery and I want you to pause how you do the delivery. And then I want you to look at their body language, the way, and that if you do it, then just nod gently, say, you know, they won't do it. And if you see, they're going to mirror your nodding. Okay, they're going to mirror that nodding, right? Yeah, it's the same thing. Does that make sense? Okay, and these are the subtleties of doing it. It's the same. If I'm going to get you to sign something, I'm going to say, John, just please wear the ticket. You just sign here, and I'm going to gradually put my hand to you. You're going to take my hand, and then you're going to sign here. Right? You're going to mirror what I do. But if I say, yeah, just sign a dotted line, you're going to get all nervous. But if I go, here, John, just take it here and just sign here, and I turn it to your hand will come up, will go down, and I'm looking at you, and I'm waiting, and because I'm just looking there, right? I'm looking on the page. You have to sign it. You can't not sign it because you go, yeah, took your hand, going then. So again, these subtle things are going to be the difference of how you're going to make the person feel by transferring your emotion, your feeling, but most importantly, you're making them feel the way you want them to feel. And so think about that in one thing. You've already cemented your client in that short period of time. Now, so the difference between, hi, John, how are you? Tell me about you, et cetera, and then you're going into this really fast. See, this slide has so much power to it. I would not, don't let planter, remove all of that. Remove the terminology I don't understand. This doesn't make any sense to me. And sometimes you're trying to be too clever. You don't need to. Show it and then go, what, and so show a slide, go, what you specialize in the foot's complexities element. And then you could say, for example, and then you could have some of the words down there, but I don't want to see plantar fasciitis because I could just turn off and think it's too complicated. And what is that in French or Japanese or whatever? And then I could just switch off. You don't want the person to do that when you're showing the first slide. So show that the complexity, make it something simple that I can read it, I can understand it. Remove the word treatment sheet, remove all those things. You don't want it that, put that there, and then make it me feel like, wow. And then you're talking, and then all this one slide just brings to life is, I'm never going to go to another doctor. I'm so glad I didn't go to my chiropractor. You're the man. You're the one that I'm going to stay with. And that's what that slide should do. That make sense?
Good.
Any questions with that?
No, I just have to practice.
That's okay. They've done a one thing because I'm pretty sure we're there. When I go into this as well, it's not too complex. It's you understand each reason why I'm doing this.
I understand. I think understanding intellectually and applying it are two different things.
Sure. Yeah. So like you with your patient, I'm talking conceptually, and then we got implementation, then we got delivery, right? And that's what we are. Yeah, conceptually. At the moment now, and you're trying to put the three together, and that's kind of where it's getting a bit skewiff, if that makes sense, right? Yeah. So think from the conceptual, like now, I'll give you a classic example. What I just told you about this slide, right? Yeah. And what I said. So now let's do the introduction. Now I come into your clinic. Let's see, and I'll show you, because this is already happening. So let's just do that now, and you watch the difference. So I walked into your clinic, guys, sitting down. Let's go.
Hey, Troy, welcome to the office.
Oh, thank you. It's good to be here.
So who can we thank for sending you over? How'd you hear about the office?
No. We're not going to make it easy. We're going to make it a bit harder. I'm a new client.
Okay, that's what I want to know. That's why I'm asking. Hi, Troy.
Oh, okay. So, you're just down the road from my office. My law firm is two blocks up.
So you just.
And my secretary, I said, yeah, I got sore foot. Secretary, find something in local area. I got a client in 90 minutes, and it's like, okay, I think it's time to come in. And she just found you here, and here I am.
Well, welcome. What's going on? How can I help you?
Yeah, so I jog a lot. About 2 weeks ago, I just running, going my normal jog, and next minute, oh God, I got this pain right up my leg. In fact, it kind of stopped me, and I couldn't even walk back. I kind of had to get a taxi back to home, and it's just kind of gradually getting worse going forward. Then last week, it really peaked, and so okay, I better stop running. And so, and I don't know, I think I kind of. Yeah, I thought I jarred it initially because I went up from pavement into the road. I thought I jarred it going forward, but recently, and it's been getting worse. And just today, I just got to have a meeting, a client meeting. And as I got up from my chair, I just had a pulsating pain going from my foot
Oh man.
all the way up to my from the ankle at the back there. So it was like, yeah, I'm a bit concerned. So I thought, hey, I better come in, because even now, if I push on it, it's hurting. It's hurting. So I don't know. Yeah, I don't know what's going on.
And you didn't go anywhere else? Where the first place you went to, right, Troy?
Yeah, look, I don't like doctors,
Dr.
to be honest.
PCP or anyone else? Yeah.
No, I don't like doctors. It was just, again, I'm here because I'm 2 blocks up, to be honest. And
Yeah.
I got secretary said, hey, can I go and see someone quickly? Otherwise, I'd probably, yeah, I probably wouldn't be here.
Yeah. Okay, Troy. Well, Troy, I think you're in the right spot. Kind of like, what type of law do you do?
I do criminal.
Okay, so you're a specialist. So the same thing with us, Troy. We specialize. This is all I do is feet, and specifically this pain in the heel that you're having is something we see multiple times a day, and we're very good at getting people better because the foot is very complex, and especially when you're running, when you're in your shoes and you're doing a lot of activity, but there are treatments, and we can get you better fast. And I know your time is important to you, right?
Yeah.
we
No
got
matter how
we
much
got
time
we
you
got a
have
little
that.
bit.
Yeah.
So I'll try to. I'm gonna go through a few things here and kind of explain kind of what's going on, and then I'm gonna give you some resources. Kind of the way you give clients things to read. I'm gonna give you certain things to read, because you might want to know a little bit more afterwards. Because I want to use your time to the best of my ability here today.
Okay, good. How do you, yeah, we're going to be, how do you feel in that delivery?
I think he was a lawyer. He's more intense and wants to value his time. So I think I
Yeah.
included him a little bit more, and I valued what was important to him.
Great. Okay. So you tailored your conversation to the person, right? Yeah. See the difference? We tailored it to a person going forward.
Hmm.
And this is something where this is a key. If you want to, one of the magic of sales, how we do it, excuse me, we don't have a standard presentation. We have a conceptual presentation. We have a standard presentation, but the delivery is different to the person that you identify. We talked about social profiles before, right? And also one thing too, just because they're a lawyer, yeah, they may not be an analytical. Lawyers are not analytic. It might be expressive, it might be a driver, it might be an amiable type of process, right? So again, we're going to learn more of that. But the delivery was good. So let's continue. So okay, that's good. Let's continue with the presentation now.
So Troy, I'm gonna just push down on your heel here. Is that where it hurts?
Yeah, hurts there, and it radiates all up to my leg as well when you do that. Yeah,
Okay.
it's like a stone bruise. Oh, yeah, but it's not.
Yeah. I'm gonna have you walk. I'm gonna watch the way that you walk. Then we're gonna sit back down. Uh,
Yeah,
so Troy, does it hurt more a lot of my patients, they tell me it hurts more when they get out of bed or get out of the car after, and then it goes away throughout the day. Is that how yours is?
yeah, it's getting worse like that. Like if I'm sitting down, in the chair, like for half an hour or something, even now, that's why I brought it here. I just got sitting down in a chair in a meeting 45 minutes, got up, and wow, the pain just radiated all the way up to my leg. Yeah.
Okay. So Troy, I like to use pictures to kind of explain things because it's kind of an abstract understanding of this problem. So
Okay, stop. Brilliant. That is that the way you said that going forward, it opened up the door, Donald, to say why you're going to show something, to explain something, not just going into it. Very good. Yeah, time went up quickly. We've got to keep going. Okay. No, please, no. Let's keep going for another a bit longer. It's on my dime. Let's keep going. I want to keep going there. Yep.
so Troy, just to explain a little bit, this area on the bottom of the heel, you might not understand this, but all you need to know is this white thing right here is
Hmm.
something called the plantar fascia. Now, the plantar
Okay.
fascia, if you look at it under the microscope, it looks the same as a tendon and it looks the same as a ligament. They all look the same. They're white. This is
Okay.
this is an example of a tendon on the back and the fascia on the bottom. They're virtually the same.
Mm-hmm.
What you need to understand is they're both playing tug of war on the heel. Okay, so if you're playing tug of war, the tendon's pulling up and the fascia thing is pulling down.
Mm.
And for many of our patients, when they have tightness in the back of the calf, no one even thinks they have tightness in the back of the calf. It's something that not even on someone's radar, but usually calf tightness is the biggest culprit to pain in the bottom of the heel. Okay, so I'm going to test for that right now. So I'm going to test for tightness. And so,
Yeah.
you know, you're very, very tight. If you look here, you're tight on both sides, but you only have pain on one foot, right?
Yeah. Yeah.
Yeah. And
Yeah.
what we find, there's only two things that can be wrong when you have tightness in the back of your calf. One is you develop Achilles tendonitis, which is pain in the back of the heel. You may have heard of Achilles tendonitis.
Yep.
And the other thing that can happen is something called plantar fasciitis. And so plantar just means on the bottom of the foot, and it's this white thing right here that gets inflamed. Does that make sense?
Yep. Yep.
And it it kind of flows to the front of the foot, and it's white. Now, do you think things that are white, would you think they would have good blood flow or poor blood flow?
I'd probably say poor blood flow, wouldn't I?
Probably poor, because things that are red, like muscles, they have very good blood flow. Things that are white, like tendons and ligaments and fascia, they don't have blood flow, otherwise they would be red.
Mm-hmm.
And that's the whole problem. When something gets injured, like the plantar fascia, and there's not that much blood flow going to it, the process of it healing many times can be very, very slow.
Okay.
And so there are certain treatments that we use that can speed up the healing. And actually, it doesn't speed up the healing, it speeds up and increases the blood flow to the area. So we have certain treatments that can help with that. Okay, we'll talk
Okay.
about that a little bit later. Okay.
Okay. Right. We'll stop there. The way you did this, Donald, is great, brilliant. Even if you notice, even when I'm role playing, you catch me. I love the slide. You catch me going forward. You got it. I want you to, in here, I want us to kind of slip in going forward. The problem we have, John, is what people don't realize is that, you know, this is something that can be reoccurring. And so
Okay,
this is
so
what's happening.
bring that up in the beginning. Yeah, okay.
Yeah,
That
right.
you
So
have it
something
right
is
now.
happening going forward. Yeah.
So the big problem, Troy, is that plantar fasciitis, it can be hard to get rid of, but also it can come back. And so it's important, you know, if you're here, it's important for us to get rid of it and also make sure it doesn't come back.
Okay, so right, it's recording, so I'm going to put some in. So, John, for example, have you ever had this pain in the past or anything like that going forward? I have, right. So, you see what I mean? So, it may not have been as severe as what it is now, but it's there. And this is something, and as we get older, of course, our bodies doesn't get better, you know, things kind of get worse. And this is something where people don't realize that, yeah, we might be able to resolve it now, but the problem is we want to be able to prevent in the future. And this is kind of one thing that I'm going to be focusing our attention on as well. And we've got treatments for that going forward. Yeah, because the last thing you want to do, John, correct, is have we fix it now, and then, you know, you're going to be back in 6 months' time or something like that with the same pain. Because then it could be a lot worse, because you can see with the blood flow going in, we need to be able to do that. So we'll stop role playing. Do you see what I'm able to do, Donald, by
You know,
doing
it's I never think it's almost like you're forward pacing and positioning for the future what the conversations will be about.
Exactly. Why? Because think, okay.
No, it makes total sense. I don't
Yeah.
think of doing that. It makes
It's
total
okay.
sense.
Yeah. Okay. Again, that's good. When you say that, I feel good because I'll help you. Because so one and one thing I want you to start doing, Donald, when you say something, I want you to kind of, and that's why a good thing is do this into into Zoom or something when you do this presentation, and then I want you to pause it, and I want you to write down the questions you can ask. So the way you did the delivery, I want you to stop and pause and think, okay, what is the client thinking and feeling when I'm asking this question? Right? Yeah. What's the client thinking and feeling when you ask that question? And then what can I say to make them feel better or extend that feeling? For example, you don't want to feel this going forward. So yeah, so these two slides, the first one and this one, this is where you make the sale without you even realizing you're making the sale. Why? Because you're getting the credibility, trust, and rapport with me as well. And even when you're showing, again, why I love these three powerful pictures, it tells me so much. I love the way you did the whiteness, that question about the blood flow going forward. I can understand that going forward. So it's like, yeah, have you had them? Yes, you have. See, so you already had this, but you didn't know it was so bad, and now it's getting worse. And if we don't kind of deal with it now, this is why the treatments we do, it affects the past. You've already had the problem, but you didn't realize. The present, now it's a bit sore. So what's going to happen, John, if we don't kind of really do the right treatment now? What's going to happen? and stop and pause. What's he going to say? Donald, what will the client
It's
say?
gonna get worse. It's gonna get worse.
It'll
I
get
can't
worse.
run.
Right?
I'm gonna
Yeah,
get fat.
Get worse, yep. And as you get older, what happens to the body's blood flow in general?
It reduces.
It reduces, right? Yeah, inflammation gets done going forward, yeah. So in some ways, you kind of, it's not again, I need to do, the treatment going forward. We might have to do an MRI, etc. But at the moment, at least we're on top of it. So we'll stop role playing. See what I'm able to do, Donald? I'm kind of I'm saying words for you to be able to pick up bits and pieces because we got the recording, right? That's what's happening here while I'm doing the role plays, right? But you see by me doing it, I'm planting the seeds that you want the person to start thinking and feeling with that transfer emotion, that we're going to take that forward into our other sessions going. Does that make sense? Okay, so these 2 slides, can you show me the third one? Because I'm mindful of time soon, but just go to the third one.
Yeah, this is the third
Okay,
one.
so yeah, let's just do this one for me.
Okay.
Yeah.
So Troy, this is an example. You can see this picture on the upper left-hand corner.
Yeah.
And this probe is an ultrasound probe. So I'm going to tell you if you're later on, I'm going to say if it's a boy or a girl. I always joke about, having babies in ultrasound.
Love it.
But if you look, this is the probe, and it's right on top of this where it's hurting you on your heel. And this, I even think, is more beneficial than getting an MRI. We got an X-ray today to see if there's any bone spur. And Troy, you don't have a bone spur. Many people, they think, oh, if I have a bone spur, that's the problem. Well, the spur isn't the problem.
Okay. Is this the okay? So this after I've done it or the exam or
this
not?
This is after you've had an X-ray. You've had an X-ray.
Yeah.
And I've reviewed your X-ray with you.
Yeah. No. Okay. So I don't want to go to that bit. I want to go to the because I want to break this down. This is after it's been done, but this is secondary. I want us to just focus on 1 and 2 because I want you to kind of go. So John, what we're going to probably do, I'm going to explain what the first things that what I'd like to do based on where it is. I'd like to take an MRI, and this is the reason why. This is what we're looking for. We're looking for this.
I want to do an ultrasound, and so what we're going to do is
ultrasound. Sorry, ultrasound. Yes.
What I usually recommend, Troy, is we're going to start with some treatments, but I just want to show this because it's important for you to see the thickness of the fascia. You see how this one's thicker than this one?
Yeah.
And this one in the middle here, this middle picture, is inflamed and it becomes thickened over time. If something doesn't heal in 4 to 6 weeks, like most things should heal in our body, they get thicker and they get inflamed and they become a little bit more chronic. And that's where I'm thinking you're at. We're gonna do this at the next visit. This is how I position for the next visit. We're gonna do an ultrasound. Okay, just so you know. So that's why all my patients get an ultrasound the next visit, because I show them this picture. Okay.
Yeah. So one thing, Don, which I wonder. Okay, so I want you to think about as we go through, we're educating the client to think a certain way you want them to think. This is why this is it, right? So it's like we've done the first one, we've done the second one. Now, John, one of the first things that I want us to do, don't tell them about treatments. Don't use those words. We don't need it. First thing which I want you to do is we're going to take an X-ray. And this is what we're going to be looking for and what I'm looking for.
They usually have already done the X-ray before I see them, just so you know.
But this situation, I've just walked in the street. My secretary got it, and I walked in the street.
My staff, if you come in with heel pain, you get X-rays before you even see me. I'm just letting you know.
Oh, okay. Oh,
I don't have to sell an X-ray, so it's done.
Okay, fair enough. Oh, okay, a little bit like a dentist. Okay, right. Okay, that's brilliant. Okay, so John, we got your X-rays here going forward, and this is what I've found out with it. So the reason why we're doing this, Donald, is when you're going, this is what I'm looking for. So this is the treatment we've done. This is why we did something. This is what I'm looking for, and this is kind of what my diagnosis will be. See, so then when you kind of go into the next part, after you do this, we go into the next part. I'm already being educated that this is the process I'm going to follow, right? Yeah, and so I'm educating. One thing that clinics, especially, they're spasmodic in their operation, right? They're here. They don't have a simple process in place. So they're bringing, two things. the nurses get confused, the doctors get confused, and even the patient gets confused. Where I want us to kind of go here. Yeah, we understand here. Now, John, this is kind of what we've identified. So this is our first thing we want to do, and then you're going to say this is, and then it's like it's like blood test, X-ray. We want this done with our doctor. We would do all that. Going, yeah, we get all that going done. You go through. Here we want to educate because again, there's no cost involved at the moment. This is all kind of free, right? So I want to say this is what we've identified here, and so then this is kind of what I recommend. Now we have two choices to go through, and then we go from here. I want us to get into that delivery, but at the moment, I want to play with that one. I don't really like that. I like this. Picture thinks a thousand words instead of what you did.
Okay.
But what I want for now, Donald, I want you to work on the opening and the second element, because are you knowing the power? This is where the sale is happening, because you're educating the client to think the way you want to follow the process.
Okay.
That makes sense, right? Yeah.
Yeah.
Okay. And these like do it into a Zoom. Go to and then and come up with the way that we word, expand those words. Again, this is going to happen very, very fast. Let me assure you, for our next session, you'll have this bound down. And then think about, take your mindset, what's the client feeling at the moment? And what could I say to make them feel different, reassure them? But this is all about the unknown. And so we want the person to kind of get a little, we want them to kind of anticipation of we don't know what's going on, because now you've got my whole attention, right? And I'm listening to you, you're showing it, and you're not wrong. You're not wrong here, you're not wrong with anything. Does that make sense? Yeah, mm-hmm. You're not wrong. And I'm going to do say something very quickly to you. Why this is so relevant. I don't know, 6 months, whatever ago, I went through and I had a skin thing go for it. And the doctor he's a specialist here, but he's so intense, no personality, no anything at all. He scares the crap out of me. Every time he sits down, he scares the crap out of me. And I hate going to him. And I said to my wife, I said, oh my God, this guy's so intense. And, but we used the cream and it worked. And so then I went to him for another thing going forward. And I said, I hate going into it. And I didn't want to go into it because he's so uncomfortable going forward. I went to him a second time and I said to him, I said, look, this is what I do for a living. I said, I'm just going to give you some advice when you talk to it. When you got this up and you're looking up and where you're showing me this, he's got the big screen up and it's looking up and he's zooming in and he'll get it done. And he's like, he put these connections on, he's looking at this. And I said, I'm going to give you some advice. I said, just have a bit more personality, because I didn't want to come back. He goes, what do you mean? I said, well, I didn't want to come back. I said, I said, if it's not serious, say that up front. I don't think this is, he said, he said, but when you got the information, you told me. Mr. John, I feel it's this there, and give me peace of mind. And I told him how to do it. He gave me a short coaching session when I was there. I went back the third time and, he said, hi, and then he had personality. He goes up there and he said, don't worry, it's nothing to worry about. I think it's this, but I just kind of want to do done. And I said, bingo. And he smiled and he said, I've been saying that to my patients all the time now. And he said, they smile, they're happier. And I said, before they were like, he said, yeah, they were tense. And he said, I didn't want them to feel tense. And I said, exactly. When you've got it up on the screen and you're sitting down and you're going like this and you're going like that, and then you bring it out. And I said, never, ever, ever bring out that white thing there which says go for tests and exams. If it's not I said, get a notepad. I said, get a bloody notepad and write it down, because I'm looking at it. And he said, I didn't understand that. He said, but no, my patient seems happy. I said, yes. I said, do you know what you represent? And he goes, what? I said, you represent cancer. He said, no. I said, you represent cancer. Everyone who comes in there has got to spot this you represent. It could be cancer and we're going to die. And he was like, and he had no idea that so now he's even doing, he's Cambodian. He's now he's my clients like me a lot better. And it's increasing business he's done. So this is something which, the opening and initial element we're doing it, that is where your sale is done, Donald. And when you do that well, that first slide and second slide, that's all you need. And then you show, and then this X-ray shows up and being done. Those 3 slides is going to get the client they're going to buy, and we're going to have a higher closing rate. But that's kind of where and then that's going to set the tone too for you to feel more relaxed and build that trust with the client more so than
Do
you've
you
done
think
before.
I need these question slides? Like how long have you had symptoms?
No, 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 no. It's
Just the pictures. Even I don't even need this, maybe. I don't even need the words on
Oh, no,
this or
no,
on
no,
that.
no. Okay, so this here, look,
You said
yeah,
take
now that I see that, because I don't, when you show me that, I don't go, right? So then, and all this is that could just buy a picture of a foot there, remove the plantar
yeah,
going foot.
this is just the front of the PowerPoint slide.
Yeah, okay, so yeah, so this one here, absolutely, this is brilliant, right? Going forward, yeah. And so yeah, this would be, I just go with this first slide. This is all you
Okay.
need. You don't need to do the
First
first
one.
one, second one. And because this sets the whole tone up, right? Why people come to it. And as long as you got the wording done properly, it is going to flow well. So yeah, get rid of the first one, second one. You don't need that. That's
Okay.
amateur. People who do that, and you see that I call it death by power. They're just amateurish. They're just following what they have seen before, and they're just shoving something out to show someone, and people don't have time for that. That because you're losing your personality. But this is brilliant. This sets it all up going forward. I love what is planned because that seems to be what happens with. I love the white bit. You just nailed it all that way. Okay, buddy.
Thank you.
Good, buddy. Okay. See you, mate. I'll see you same time next week. Okay. Take care.
Okay.
Bye,
See
mate.
you. Bye.